Good afternoon. Thank you for the opportunity. Allow me to introduce myself. My name is Setiono. Allow me to represent my team to present a study about the effect of COVID-19 pandemic in geriatric rehabilitation services in hospitalized patients in Indonesia. So for the background, as we know, COVID-19 is a disease caused by SARS-CoV-2 virus that can infect us mostly about through the respiratory problem and also can cause a multi-system organ failure. So this disease is easily transmitted via droplets and a close contact between two person or more than 15 minutes, less than 1 meters, can increase the risk of getting transmitted with this disease. This kind of situation poses a threat not only for the regular people, but also for the healthcare services. As we know, there is some higher risk population like children, people with comorbid, and especially geriatric patients is a population with higher risk of getting transmitted with this disease. And whenever they get transmitted with this disease, they have a higher risk of getting more severe symptoms of COVID-19. And during inpatients, general inpatients geriatric, usually the geriatric patient have a very reduced activity daily living. Almost all the activity daily living needs supervision or helps from their caregivers. And it is our rehabilitation duty to make sure that the patient didn't have decommissioning syndrome during inpatients and can be discharged with a good activity daily living function. So rehabilitation itself is a process to help the patient regain functional after some illness. And in patients in conventional rehabilitation services, it requires a close contact between the doctors or the therapist with the patients. Usually it will last approximately about 30 minutes or even more than that. This kind of settings, this kind of situation during this pandemic is will be a threat for the healthcare services itself or the patients even more. So to contract a COVID-19. So the rehabilitation teams make some adjustment by reducing the aerosol generating procedure and also reducing the contact with healthcare, and also if they can reduce the visit to hospitals, we choose to patient to do that. So that is why telerehabilitation is a method that lately really popular to do rehabilitations. So especially in inpatient setting, telerehabilitation can help to make timely visit to the patients, but with lower risk of transmitting the disease. And in this kind of setting, we encourage caregivers to be a supervisor to do the exercise and also to monitor the exercise. And we also give the patients and the family a logbook to be filled up. But the one question arises, is this kind of setting enough to increase the activity of daily living of the patients during the inpatients? Is it enough to reduce the possibility of decommissioning syndrome? So we try to do a small study from June 2020 to April 2021. It is a cross-sectional design and retrospective cohort. All inpatient geriatric patient who was consulted to rehabilitation was included in this research. So rehabilitation assessment was done directly in person by the doctor at the first visit. Then the doctor made the programs. But the rehabilitation programs and also follow-ups was done via telerehabilitation. The caregiver was also given educations at the first visit about how to do the exercises and other rehabilitation programs. And a logbook was given to the caregivers to monitor the compliance. Before the time of discharge, a 6-minute walking test was done to the patient. The 6-minute walking test itself is a submaximal cardiorespiratory exercise testing to test the cardiorespiratory functions of the patient. So we got 28 subjects with the mean age is 61 years old. 75% of subject was male, and the underlying disease that get the patients admitted mostly are diabetes mellitus, and there is also pulmonary diseases, renal problems, and it's also cancer. And for the 6-minute walking test, we always see the before and after, and also during the 6-minute walking test. As we can see, the patients tolerate the 6-minute walking test quite well. There is no significant increase in blood pressure, in heart rate, in respiratory rate, and also in oxygen saturation. So before and after the 6-minute walking test, the patient feels fine. And the result from the 6-minute walking test itself, we get the distance. We instruct the patient to walk as fast as possible as they can during the 6 minute in a track. We use a 15 meters track. So we counted the distance that they can reach between that time. So we got the result is 196 meters. And if we converted the distance into VO2 max using a formula, we get a 69.98 kilogram per milliliter per minute for the VO2 max. And then we also converted again into a maths. A maths itself is a nominal for each activity that a person can be done. And the average maths that can be, then we get from this 6-minute walking test is 2.82. As we know, the average required maths for the basic activity daily living is 2.4 maths. So we can see that although we didn't see the difference before and after of each patients, but if we see the average maths, almost all patients can reach independent activity daily living by watching the result of this maths. So for conclusions, the COVID-19 pandemic required rehabilitation services to make some adjustments into their services, especially in geriatric patients, as it is an increased population risk. And telerehabilitation during inpatient geriatric care in this study showed a promising result to maintain the functional capacity or increase the functional capacity of the patients. But the protocol itself is not yet standardized. So some proper study to test the protocols of telerehabilitation in inpatient settings still need to be constructed or to be done. Okay, that will be all for my presentation. Thank you for the opportunity and thank you for your kind attention. Good afternoon.